Now we will invite Mr. Kim up to the stage. Please welcome him with a big hand.
안녕하세요. Sorry. Hi, my name is Holden Kim, and I'm a CEO of LabSD. At LabSD, we vision for the world without barriers to quality healthcare services. And to let you know exactly what we do, I'm out of breath. Let you know exactly what we do, I need to introduce you to Mr. Jamana Prasad. Mr. Prasad is a 58 years old male living in Pihani, Sitapur in India. He decides to get a pair of glasses because he was experiencing blurry vision. So he visits this vision center. Vision center is a health center that only focuses on eye problems. And he got the glasses finally, but soon he realized that the glasses are not helping to solve his problem. So he gets the glasses again, and again, and again. After 1 year and a half and 11 pairs of glasses, he finally realized that glasses are not going to help him. So he goes back to his daily life with a defeated heart, with the worry of being blinded and losing his job because of it. One day, he hears from Vision Center again that there's a new device that can diagnose him for other diseases. So he goes back to a Vision Center. This is how Mr. Prasad got his first retina exam, and his diagnosis was diabetic retinopathy. And he was transferred to the Sitapur Eye Hospital, and he was cured. Diabetic retinopathy is, along with other fundus-based blindness-causing diseases, are fairly easy to screen and prevent through the treatment on the right time. But if you're living in resource-limited conditions like Pihani, Sitapur, the story is totally different. There are about 253 million people who are either blinded or visually impaired in the world. And about 90% of them live in resource-limited conditions, which means there are billions of Mr. Prasad out there. Members of LabSD has been working in the field of global eye health for more than 15 years now, and we are recommending EYELIKE to solve this problem. We have developed a digital ophthalmoscope that can take the picture of the fundus. It's a back layer of your inner eye, and we can diagnose diseases like age-related macular degeneration, diabetic retinopathy, or glaucoma, and they are responsible for about 21% of world blindness. One thing that I can assure you is that this is the most efficient way of collecting fundus images in resource-limited conditions, because the price of the device itself is only 2% to 5% of the conventional devices. And we could keep the price down because we are using used smartphone. If you think about it, in used smartphone, there's a camera, a display, computing power, and internet connectivity as well. We are using all these functions. And for that, we collaborated with Samsung Electronics Galaxy Upcycling program and Minted for the procurement and quality assurance of the used smartphones. So the picture that all those organizations are throwing together is that the smartphone that otherwise would be causing environmentally harmful effect is now being used for the betterment of the eye health of the people in resource-limited conditions. We also have an application and the web-based health information system to provide the teleophthalmology. And we have been providing the service for 2 years now, and we have screened about 37,000 patients, and we have collected about 87,000 labeled fundus images. With those images, we are developing AI-based clinical decision supporting system now. After 2 years, what we have learned is that in India, especially the rural areas, about 30% of the people are not capable of paying for their own treatment. That is why we are trying to connect them to the global donors with our online donation module and patient tracking system. So we wanted to add fun and transparency in the donating system. So we are building this platform that donors can see where they are donating, who they are donating to. And in the process, we are going to let them know close to in real time that whereabouts of the patient and conditions of the patients as well. And at the end of the whole process, there are going to be the amount of the money that donor has donated and number of people that donor has saved from losing sight as well, to encourage the reoccurrence of the donation. For the phase 2 and phase 3, we're going to go for AI and big data business. But for the first phase, we are relying on the sales of the device and the platform subscription, along with the CSR collaboration with the big companies. And we believe that there are going to be the eye hospitals in India are going to be subscribing the service because of the platform. They can cover more areas, which means there are going to be bigger pool of the patients. And normally they lose 30% of the patient, but the cost for the treatment of those 30% is coming from the platform as well. We are expecting about 50 million revenue in the year of 2026. And we are targeting to provide at least one platform in every 50,000 population. As aforementioned, members of LabSD has been working in the field of global eye health for 15 years now. And one thing that we have learned from the process is that we cannot solve this problem alone. That is why we are defining EYELIKE as an ecosystem, inviting different partners from various areas. It could be from the community, vision centers and local people, to the manufacturer of the materials, and those who's going to support us for the delivery of the service providers, service payers, and organizations that can give us directive from the big data we provide. So basically, they can contribute to their own mission, and our job is to orchestrate it to our direction of preventing avoidable blindness. So, what do you say? Will you be joining us for our mission of eliminating avoidable blindness? Thank you very much. And I have about a minute left, so I just decided to show you how this device works. Can I have the screen? So this is not the picture that you get to see every day. And if you are more than